Hello and welcome back to SLT time. This is episode 5. We are really going through the week so quickly. Last week we discussed workplace conversations about race, and guest speaker Nazia Rizwan was here. We received so many tweets in response to the episode and would like to share a few that stood out.
The first tweet that we would like to share is by Sai Bangera, so at Bangera Sai. My thoughts. Fab advice by Nazia Rizwan SLT on career progression and workplace culture. Building cultural competence is an ongoing process, and cultural differences do influence engagement during meetings, but shouldn't pose as barriers. And being soft-spoken is not a weakness. So those were some of the reflections that Sai shared with us. So thank you, Sai. Another tweet by inclusionista_1, so that's Aiden Sufi. Another brilliant podcast from SLT Time with Nazia Rizwan SLT. Thank you for raising such important points, which includes cultural norms and how we relate to elders or people in authority, importance of BAME support community at work, and how to deal with microaggressions. And ensuring work socials are inclusive to all. It shouldn't be left to the person who is excluded to speak up. We should make sure that the social is not in a pub or on a Friday if that excludes team members of different faiths. As for speaking out about microaggressions, that takes courage. I think there needs to be more training within the profession on what microaggressions are, how damaging they can be, and how to respond when a colleague tells you of their experiences of them. Thank you again for this important work. Thanks, Aiden, for your tweets. And lastly, by Henny_Bernstein. Really enjoyed this week's SLT Time episode, learning lots. Also great advice on banding and job progression from Nazia, making me feel better about my current position as well as motivated to take the next steps. Also, the comment about if staff go to the pub on a Friday night and you won't do that, you aren't part of the clique. That's massively my problem and I struggle with that a lot. Sadly, telling people my reason hasn't changed anything. Thanks for sharing that with us, Henny, because I'm sure a lot of people also feel the same, being the odd one out in terms of like workplace cliques, and I think that's something that we can continue the conversation in further episodes as well, in terms of workplace culture, whether that's about racial biases or exclusion. So thank you.
So this week's episode is focusing on cultural competency, what it is in theory, our experiences of being taught, and how we'd like to see it being implemented in real life practice. From SLT Time, we have our hosts, which are Ilya, Veronica, Suleka, Taiba, and myself. And we have our 3 amazing guests, which are Sharon, Mariam, and Mehreen.
Hi everyone, I'm Sharon Ajay-Nicol and I'm a speech and language therapist working with adults. Currently I work in private practice, but I have worked in the NHS for about 15 years. And from September, I will be joining the University of Greenwich and Canterbury Christchurch course as a senior lecturer.
Hi, my name is Mehreen. I'm an NQT and I work at a private practice. I'm doing a mixed post, so I work with both pediatric and adult population, and primarily I work in secondary schools.
Hi, I'm Mariam. I'm a speech and language therapist, work with children under 5 mainly. I work in the NHS and I've done that for about 4-ish years now, nearly 4 years. I've only ever worked in the NHS, so kind of just, that's where all of my experiences are.
We're all becoming experts on podcast introductions recently, isn't it? We all know what to say when we get up. We are. So, thank you all for joining us. We're really, really lucky to have you all here. Me and Mehreen go way back because we actually did the course together. We were the same cohort at City, so nice to see you, girl. Okay, so I'm just going to give a sort of brief overview to provide a little bit of context into the reason that why we're having this discussion. I actually gave this talk in a bit more depth at Sheffield Uni a few weeks ago, and the questions that I got from the SLT to Bs that I spoke to were really incredible, and they were so engaged. And while that made me really glad, it also made me really disappointed at how this was the first time they had been given this information, and how shocking it was for them to instigate these type of conversations. So anyway, I thought it was really important to start the discussion around cultural competency by first having an overview of the context of the country that we live in. So Britain has a history of colonization. That we all know that, that's a fact. But how does that impact the cultural makeup of the society that we live in now, and the society that we're all working in as speech therapists? Colonization was a system and governance which basically meant that anybody who was not white was inferior. There was slavery, oppression, cultures were destroyed, places were ripped apart, lots of people were displaced, causing forced migration. Pre-existing political, social, and economic structures were basically destroyed and recreated into a Western framework. And then obviously we've got this sort of emigrating demographic of migrant communities in Britain. We've got an increase of first and second generation young people, so parents who came from abroad moved here, and then their kids were born here, who are navigating like really complex identities, being from a migrant family, and their parents seeing the world through a particular lens, but them now having to navigate where their Britishness fits in that. And I think that not having that understanding is really detrimental to us as healthcare workers, because how can you really help a population that you don't even understand the context in which they are thinking and viewing the world? And this is not just in terms of identity, which is vital, but also the way attitudes and the way these communities are towards healthcare, towards their own health literacy, towards their perception of self, the importance that they put on their health and going to seek help for problems that they have. These are all things which are impacted by a historical issue of inferiority and belief, systemic belief that we are not worthy or we are below white people, basically. And then within that, there's obviously intersectionality and how complex it all is, and everybody's varying experiences, everyone's varying family makeups, communities, support networks. It's so complex. And I know that's very overwhelming for universities to approach because it's so complex. But I think what I would love to talk about amongst us is how we can incorporate this sort of really basic understanding of community, basically, within our teaching at university. Also, really quickly, I've just got some facts on ethnic diversity within the UK. This is from the Gov National Statistics. So I'm sure it's no surprise that 40.2% of residents in London identify as BAME. That is, we don't have speech therapy statistics, but we have NHS statistics that show that our workforce is not representative of that, especially in London. 13.4% of people are born outside of the UK that live across England. Also, there are literal stats that show that Black and ethnic minority people are more likely to experience deprivation and have poorer health outcomes. And across schools in London, there are over 300 languages spoken. So these are stats from like 2011, and I'm sure more stats have been made now. So yeah, that's the sort of context and overview that I think it's really important to touch on, because we're not actually touching on this at university, I think. Not enough, and not in the depth that we need to be. So I think the first question I want to put out is, what is your experience of cultural competent education from your experience at university in the speech therapy course, or before or after that? What is your kind of personal experiences with that?
Just to say, I think my experience of being taught about culture at uni was basically non-existent, and I think that in itself created a very interesting vacuum for me to fill for myself, and kind of inadvertently facilitated a period of significant growth that came out of significant struggle and significant isolation, and kind of feeling deeply in fact, it was probably my very first experience of being confronted with my minority status. And just for a bit of context, I was at the time a visible Muslim woman, so I used to wear a headscarf when I was on the course. And I think, yeah, it just really, it was quite confronting, probably is the best way of describing it. It just really made me realise that I am actually having sort of, you know, been born and raised in London for the majority of my life. It was, yeah, just the first time in my life I was in a room where I was the only person of colour. That had never happened to me ever before. So, yeah, deeply confronting, deeply challenging, but also facilitating some serious interpersonal growth, for which I am tremendously grateful.
I mean, from my point of view, I was training, you know, back in from 2000 to 2004, so quite a long time ago, and I'd like to hope that things have changed to some degree. But I think at the time there was very much a sense of like confusion between like bilingualism and culture, and kind of quite a lot of emphasis on kind of working with people that are bilingual. And maybe the odd little kind of reference to cultural expectations of different minority groups, but I always felt that the two things were kind of put together and lumped together as one, like, but as we all know, and as you know, over the years, and as the discussions have continued, like more recently, that it's two very different things. So I think that's one thing that, on reflection, I look back at my university and just kind of days, and just think that kind of, you know, that separation needs to be there. They're two different things. And also, I think the few times that things were touched on, I always used to think it would always come across quite negative. So things would be said like, oh, you know, if talking about BAME people, it would be sort of seen as, oh, they're hard to reach group, or its expectations might be sort of different, or they might not engage, or it just, if there was a reference to cultural things, I felt it was all, you know, inadvertently. I'm sure it wasn't, you know, conscious and on purpose, but it kind of, I felt, did cultural things always seem to get framed in a slightly negative perspective, as opposed to kind of looking at it as, well, what do we do? Like, what can we do to engage? Like, what is it that's making it them kind of not attend, or whatever, or even seeing the positives? Like, I've always found that people often BAME people are slightly more compliant, because they have that kind of seeing you as the expert, and kind of, so why isn't it framed in a positive? Like, they're more why? So I kind of, the few times that I do think culture's referenced, that there can be sort of slight negative kind of negativity to the way it's framed, but overall I think my reflection is that the two things are kind of sometimes get lumped together and need to be kind of really differentiated between someone's language, pure language thing, you know, speaking more than one language, or English as an additional language, and what is someone's culture. That's so much richer than just language. So yeah, that would be kind of, in a nutshell, my first thoughts on that one.
I think it's so interesting that you mentioned that being negative, because now I'm looking back and thinking about it. I can't remember any time that culture was actually mentioned in a positive light. So I feel like even if I'm an NQT, and just graduated last year, I feel like the same experience still. In terms of culture being addressed in uni, I was just like brainstorming, and I think there's like 3 different ways. One was in clinical exams, where they wrote like a different ethnic name. 2 was when they told us to change like the color of the person in the pictures. And the last time, I think at the end of when Ilya and I were on the course, we had a course on cultural competencies, which I think was like one of just during our professional development courses. And I did actually look back at the course to see what was covered, and I do think that they attempted to at least talk about what culture was, talk about being reflective of the experience. And I've noticed from that they talked a lot about in relation to a service user rather than to the profession itself in terms of our colleagues. So I felt like that's something that could really work on a bit more in terms of professional development. But I feel like we all do have similar experiences regardless of which university we went to.
I think with what you guys have said about it being seen in a sort of negative, very negative tones, for me it was noticing that any times like DNAs were mentioned, like do not attend or do not attendees were mentioned, it was always to do with Black and ethnic minority communities. So like, oh, why did this family with like 6 children, why did the mom not attend with the child? And it was like, oh, maybe they just have a different view on timekeeping. And I was like, this is the extent of the cultural competency competency, for me, it was really frustrating. And I think what Mariam said about it being very confronting for her, for me, I think it was very an opposite experience. I was growing up in a very white area, in a very white school, primary school and secondary, so that development of realizing I was different was very slow as opposed to very like sudden. So when I got to university, I was really frustrated throughout all of these sessions of cultural competency teaching, because for me, I was thinking from the perspective of someone who was white and middle class, who has never ever had to ask or think about these questions, and I was trying to see the teaching from their point of view, and I found it just wasn't tapping in. It wasn't getting to the foundation. It was getting to the right to the bottom, like bottom up approach. It was almost assuming they would understand all these nuances that were being talked about, and I just don't think it was.
Say that I think that it should be from the beginning of university and like integrated within all the teachings and not just added on, as we've said, with like bilingualism. I think that every aspect of learning that we have, there should always be culture involved, because the people that we serve are so diverse. And I think a lot, especially as most of clinicians are from a white middle class background, and a lot of the time they relate culture to a colour, and with different colours you have different cultures. So like in India, there's so many different cultures within India, and I think people, I'm not like, as someone who's white, they might just think there's one culture, like monocultural, but and I don't think there's an awareness that there's more cultures to a country than just it being monocultural, and that teaching should be added on and supported when it's for all teaching. I think that it can go across all modalities.
Yeah, so I was at university from 2008 to 2012, and there was absolutely no cultural teaching at all. And that really surprised me, actually, because I was at university in Leicester, which actually has an ethnic majority. So over 50% of the population of Leicester is BAME. So I was really surprised at how there was literally nothing on cultural competency when we were basically, like, a lot of the service users were BAME. So I do feel like we should have had a lot of teaching on that. And yeah, it really surprised me. But I know a lot of people are saying also that bilingualism and culture should be two different things. But I do think we should separate them, but also there is a place for them to be combined as well, because, you know, language and culture is like inextricably linked. So I think we do need to talk about that as well. So, you know, you have to separate certain parts, but other parts do have to be combined, you know, because even just the way that children learn language, you know, from the very beginning, language socialization, there's different language socialization strategies for different cultures. So I do think it's really important to look at those things as well.
A lot of the time when we talk about culture, it's like everyone who isn't white has a culture, but it's really important to also acknowledge that British, English, white people have their own culture. We're sort of trying to assimilate with that while we're on the course and fit in, and we're always like the other, you know, oh, these kinds of people behave in this way and people from that country behave in that way. But actually, how do white British people behave? No one talks about that. It's like they're the baseline and all of us are different to that. We're veering off. And I think that might be more to do with the workplace, but also I think at university and on placement as well, it's kind of like having to change our practice, but our practice should be including all cultures, as opposed to when you see a Somali family or a family from Pakistan, that you'll behave in a particular way or they're more used to this way of working. So I think it's acknowledging that everyone has a culture. It's not in my culture to drink a cup of tea however many times a day. That's something that I had to learn about when I started working as a speech and language therapist. I was sort of like, well, I've had one today, like, but just genuinely, things like that are not in my culture. And I think maybe for some people, but for my family culture, we just don't do that. And I think a lot of things we just have to pick up And I think speech and language therapists, when we're working and we're communication specialists and we know all about this, they should be able to pick this up. And I think at uni they have that responsibility to sort of incorporate that, as Andrew was saying, and really try and foster that curiosity about other people's culture.
No, definitely. And I think like what you're saying about acknowledging that there is a white British culture, actually, we as people from Black and ethnic minority backgrounds don't really have a choice in having that self-awareness of our culture and our differences. But actually growing up white, privileged or whatever, you're not really confronted with that level of self-reflection. And I think cultural competency education doesn't necessarily need to be you sitting in a room learning, okay, this is how this community does this. It begins with that self-reflection of what is it that makes up my cultural makeup and my views and my privilege, and how does that impact the way that I view the world and I'm interacting with people. And I think until we're fostering that level of self-reflection from the course as health professionals, then when you're not able to really understand others and how others view the world, because you've not even worked out which lens you're viewing yours in. So I just feel like we do a lot of talk about reflecting and self-development, all that in the course, but it's not put in this context in the right way. It's more about sort of clinical skill reflection, but the whole point of the personable nature of our career should also incorporate that, I think, and we should be given that space to do that in university.
No, I completely agree with you there. I remember on my course having to video ourselves communicating with a colleague, and then really go back and analyse and write a whole essay about our communication style and what we do. Who uses body language, who's really proper reflection. I'm just thinking, but that level of depth needs to be applied to other elements as well. What am I bringing, especially people that work with adults, kind of you're working with a peer and somebody's sometimes older than you, and just what am I bringing to this therapeutic relationship in terms of my biases, my thoughts, my understanding of them as a person, their identity. And I think that exactly what you said, we need to spend time during the course understanding our clinical skills, our communication skills, but also us as a person and what we're going to be bringing to our relationships with parents and everything else. And I think once you've got to that level, then actually it doesn't matter whether it's white culture, Asian culture, black culture, because you just apply it to everyone. You want to get to know everybody, every individual that you're working with. You get to know them as a person and understand what you're bringing and what they're like. And because you don't want it to be like a kind of this thing of, I've got to think of the person's culture, and it needs to be something that's natural, that we think of as holistic. When we think of holistic and person-centered care, that this just comes into it anyway, regardless of the person's colour or what language they speak or whatever. It's just applied generally and just seen as part of holistic. When we talk about holistic care or whatever, it's just part of it. So I think it needs to be that self analysis, and then from there just something that's incorporated into everything that we do, and it should eventually become a natural thing, that it's just applied to what you do as with everyone that you see. Yeah,
I think that's a great point, Sharon. And I think it reminded me of I've been on placement a few times now, and I've been on shadowing SLTs a few times, and a lot of times I've gone into the staff room and I found a folder that sort of gives a rule of thumb or a basic description of what Muslim families do or believe in, or what African families do and believe in. And for me, I just think it's so almost reductionist sometimes. I understand where the intention is coming from, and I understand what the point of it is, but like you said, without that self-analysis, without adopting that sort of self-awareness, these sort of documents are reducing people to stereotypes, because not every subgroup that we're talking about or cultural group is homogenous. Me as a Muslim family might be completely different to Ilya as a Muslim family. Do you know what I mean? So I think this is the idea of what I would want to change in terms of cultural competency teaching, is that I think learning has to be slow and repetitive. Having 1 hour cultural competency sessions in a year, which was what my experience was, it was 1 hour in one module per year over the 3 years, and that was it. But it's just not enough. This idea of self-analysis and self-awareness has to come from continuous probing, continuous work. That's what I would like to see improvement in cultural competency from everything that we've discussed so far.
I think you made a really good point about being self-reflective in the way that we interact with the culture, regardless of being the white British culture. Because I actually moved to the country, UK, about 2 days before I started the program, and I went right into adult acute, and I didn't know much about British culture. So a lot of it I had to be aware about what I was doing that was probably maybe not appropriate or maybe need to be changed. For example, I kept calling pants for trousers, and I realized that's not okay here. So there's a lot that I had to reflect on what I was doing, and I think that's actually a really good skill because it taught me to really just learn to ask my clients and my patients about their culture. So for example, simply, what do you do in the afternoon? How do you spend your days? How do you spend your weekends? Because that's part of your culture. And I didn't know really in the area that I was how people do that. And now that I'm in secondary school in a completely different community, I've learned to do the same thing, just having this discussion. So not reducing it, oh, African families do this, but rather, how does your weekends look? What do you do? And just being comfortable having that conversation. And that skill definitely could have been taught more at university.
Just really quickly, I feel like this whole idea of you know, the intention is there, and intention is a good one when we're trying to sort of give people these rule of thumbs to think, oh yeah, the Pakistani or the Muslim families don't like the pigs, so make sure you put them away, that sort of thing. I think sometimes it's okay to call a spade, and actually I think that is just ignorance, and it's coming from a place of fear. I think I think generally within institutional establishments, it's okay to acknowledge that we do exist in a culture that promotes kind of a single normative pattern and way of thought. You know, we are taught within education, particularly including university, that there is this sort of universality that we are learning about, and that's the sort of the norm, and then there will be exceptions to that kind of universal idea and that norm every once in a while. Every once in a while you have like a bilingual family, so make sure you know a little bit about that. Every now and again you'll have like people who look different, they're a bit brown, blah, blah, blah. And so I think it's slightly and I think I haven't been in any other space where that's highlighted or as prominent as it is in speech and language therapy. And I think that's very reflective of the people who design and teach these courses. I think it's really, really apparent that actually they are all from that kind of universal norm, if you like. They are coming from that singularity of viewpoint. But I think it's a huge problem, because actually the pedagogy, if you like, almost needs just rethinking. I think we actually need to have some space and some commitment to reimagining what this needs to look like, because I think it's not really creating a workforce that has the skills required to kind of navigate working with the population they exist in a way that actually supports people to meaningfully engage with and access services. And I think that having that folder in the staff room comes from that acknowledgement on some level, that actually we don't have the skills to work with these people meaningfully. Here is one stab at it. But actually I don't think it's meaningful enough. And I think that's where the kind of the educational institutions have a really pivotal role, because that's that place where people are there is an expectation that we are here to learn. And I think depending on how that course is designed and what's covered in that course is really just a testament to the society that we live in, because those are choices that are made by someone somewhere about what goes on the curriculum. So I think unless there is an acknowledgement at that level that this is an important consideration for the future workforce, I think change is going to be marginal, if at all.
Yeah, definitely. I mean, it's definitely down to the people who are creating the courses. But I actually think it's probably down to individual universities, because I know the courses, what's studied as part of the course does vary from university to university. Like I know at the University of Reading, they do like a whole module, like 10, 11 weeks on bilingualism, but you know, a lot of other universities, they don't do anything. So I think it's down to maybe the lecturers, you know, collaborating together and deciding what they need to teach. So yeah, it must just be down to, you know, who's working at the university and, you know, which direction they want to take things. Because if there were lecturers that really cared about cultural competency, then I'm sure they would be able to, you know, create a module around that. So I guess, you know, we have to look really at the staff at the universities and, you know, ask them why they are not creating such courses.
Yeah, I mean, from what I understand, I think there is a core kind of component that is provided by like RCSLT about what has to be covered in the course. And then, like you say, a lot of it in terms of how you teach that comes from the individual interests from a lot of the lecturers. So if they have a particular, if somebody has a, you know, as I go into lecturing now, obviously I'm going to have a particular interest in, you know, aphasia and, you know, the diversity discussion as well. So you might find that, you know, but I think you're right. I think there is an element of individual institution, but I think there probably could be a bit more of a discussion with whoever's forming that framework of what has to be covered in an SLT course, which that does exist somewhere, needs to make it much more emphasis that cultural competency needs to form, like everybody has to get taught, you know, on aphasia or whatever, like those things, it needs to be in there, I think. And then I guess from then universities will feel obliged to look at how they're going to cover that and you know, and how it's going to be embedded in what they're teaching. So I think it's a bit of both. But yeah, I definitely agree that, you know, you'll find courses where people have a particular interest and you see that things are covered in a lot of depth, and then somewhere else you don't get so much because it depends on who's teaching there. But I think a framework could exist that makes it more compulsory for universities to cover certain things.
So yeah, you touched on a really good point there, Sharon, about that you will come into teaching now from having that personal experience and interest in embedding culture into what you teach. And I think that's so important. And I would love to kind of hear what your approach would be to your teaching coming from this perspective. But before that, I just wanted to make a point. I think who Ange mentioned about embedding cultural competency from the very beginning of the course into everything that we do. I think that is so doable. That's not completely an outrageous thought to put out there to universities and courses. Really simple things. So things like, for example, we get drilled into us ICF, but why is it we never consider, for example, creating goals from ICF that are culturally relevant to the patient that you're working in? For example, like a participation goal about attending group prayer or visiting family and stuff like that, which are culturally relevant to the person that you're working with. But when nothing that we're taught is ever put into that cultural context, where I think that it can be from the beginning, everything, every framework, every evidence, even though there's no evidence behind culture, there's not a lot of research or evidence done on actual, you know, cultural experiences. I think that it's not such a huge ask to translate that into that narrative. It's just about who's going to do it, who at the university is going to take that responsibility, because it is extra work for them and nobody wants to do that. So yeah, I would love to hear kind of what your approach should be, Sharon.
Yeah, and obviously, I mean, I haven't started the role yet and it's hard, but I think for me, it's about, if we just always start from the foundation of who is my client, who is this child, who is this adult, I don't think you necessarily have to, it won't be as hard to teach this, because if we start from an element of get to know that person that's in front of you or that family, or, you know, then actually everything should come from that. So I think my approach is very much about designing your therapy or even your assessment session from what you find out. You know, often we kind of go in with the assessment already planned. Oh, you've got the referral that says they've got X, Y, and Z, so I'm going to go in with X, you know, assessment. But actually spending that first bit of time getting to know the person and getting to find out about them, including questions about their culture. And I guess it's about supporting students to know what kind of questions to ask to get this information out, and then designing from there, what you need to do with what you need to find out, what assessments you might need to do, and kind of how treatment goals kind of link in with that them as a person and what their identity is. But I also think it's quite important in the history taking, like often there's like these forms that are kind of quite generic about, the background history and medical history. But I always ask things like, what do you know about speech and language therapy? Have you, because I find that question quite interesting, especially because, like I say, I work with adults who've had stroke, and it's really interesting some of the answers you get, and sometimes that helps kind of frame that cultural discussion, and then kind of be like, oh, because they think of a speech and language therapist as to do with kind of speaking, like the English accent better, or, and it just kind of, so I think, there's so many elements that I can think of where I've learned along the way kind of how to ask certain things, like kind of just not just taking the kind of paper kind of form, but just actually getting to know somebody, asking them their kind of where they're coming from in terms of their experiences of speech and language therapy, or what they think what do you think speech therapy is going to be like? What do you think we're going to do? And also building that foundation of when you see somebody, and we talk about holistic care, and we talk about person-centered goals, that includes the culture all the time. So it's not just, what's wrong with them from a speech and language therapy point of view. It includes culture. I don't think it's about book stuff. I don't think it's about like, everything that happens in this culture, everything happens in that. Like, it's about just supporting students to ask the right question, to embed that into what they're doing, and to not go in with any assumptions. You go in and you ask first, and then you design from there. I think sometimes you probably do things slightly the other way around, and kind of coming in with our expertise and then kind of trying to make the person, what they say, fit into what we already had planned to do. But I guess if you go from that approach, then things like that, the fact that they go to prayer and things like that would hopefully come up. So yeah, I think it's
I think that's really good. Yeah, I think that's really good. I mean, it would really help, get rid of the stereotypes that we're taught about, like all Muslims do this and all Asians are like this, because, if you go in with that, those questions in the case history, then you're going to really get to understand the client, and that will hopefully stop you, getting into any of those stereotypes. And what you said, Mariam, earlier on about, removing the pigs, that actually, I did actually see that happen on one of my placements, actually. And now that you've said it, I'm wondering whether that was an actual thing, or whether it was just the therapists, stereotyping. Because I was working with a deaf child, and the speech therapist who was regularly there, my placement supervisor, she was like, we have to remove the pig because he gets really, really, he really hates pigs, so we just have to remove the pigs from this, box of stuff before we work with him. And I'm thinking, well, I never saw him react to a pig, so I'm thinking, did he really have that strong a reaction to a pig, or was it just because it was her stereotype of how he was going to react?
The exact same thing happened to me, where a speech and language therapist told me to remove something because there was a Muslim client that I was working with. She was like, you can just remove the pigs. And I was like, what? But why? I said, there's literally no reason why we'd want to do, like, why we would have to do that. It's not offensive to us. But I had the same thing with when I had clients who were Jewish as well, where someone told me, oh, make sure you don't use these kind of pictures because that's offensive. But I feel as though it would just make much more sense if we just ask the clients themselves and parents.
It's funny what things people are conscious about being, careful with, and what they're not, like blatant things that are just rude, that they just don't think twice about.
I think just to pick up on something that Sharon mentioned, so in terms of, how helpful is it for people to just almost have like this encyclopedic knowledge about, that culture and that culture and that culture. It's slightly, and also I think, Ilya, just going back to how you introduced the podcast, I think thinking about the context of the UK and the nature of kind of migration, and now with kind of second, third, fourth generation immigrant communities, how relevant are some of those facts and information is another conversation that needs to be had. So I think actually what we is perhaps more, if we're thinking about universities who are teaching these courses with time constraints and choices that need to be made, essentially, I think a much more useful approach to
some of that is perhaps thinking about kind of structural vulnerabilities and making sure that the future of our profession has a really good grasp of what, for example, some structural vulnerabilities might look like in the UK and in our context. Thinking about like health outcomes and how they are impacted by kind of poverty, inequality, discrimination, and kind of how engagement with our services will be definitely will be working with some of the most vulnerable, marginalized groups in society. The fact that there is this huge, I work with children, so that's where the majority of my kind of knowledge and information lies, but there's huge overlap with sort of language and communication needs and socioeconomic deprivation and disparities. And so it's almost inevitable that, for any speech therapist in the UK who's practicing, is going to be working with some of the most disadvantaged communities in the country. So I can't understand why that isn't a priority in terms of the curriculum. And I think that one of the huge, but we are essentially at the moment, the status quo is we are creating professionals who are at that level where they're putting the pigs away. And I think that's really illustrative of kind of where we're at, but what's our starting point. And I think it's a sad one, but it's a realistic one. And so actually, I think if anything can change, can we be thinking about producing clinicians and speech therapists who are kind of have the ability and the capacity to sort of critically self-reflect. And again, some of these things are already, they exist within our profession, within our training. They're just not being utilised to their full capacity. I remember having to write reflective logs as part of my, whilst I was on the course, and having to reflect on various issues. But I think, again, it's what's important to be reflecting on needs to really be reflected on. And I think at the moment that's a really big gap. And I think, again, part of the issue here, again, from my limited knowledge and kind of just my own personal experience, I guess, is the will to do some of that thinking and work, I'm not sure is there. Because I think if you have a kind of a majority white profession, majority white teaching staff, I can't remember being on the course whilst I was training and seeing a single other person of colour in terms of the faculty that taught me. Who is there to do some of that? Who is at the table who's going to ask those difficult questions? Who is going to be that critical friend and say, hey, what have we thought about X, Y, or Z? And until we're ready to have some of those people present in the room and be at that decision-making table, I can't see change happening, really, because we haven't got the right minds where they need to be. We haven't got the people where they need to be asking those questions so we can mobilise change in an effective way. We're just paying it lip service.
Yeah, I guess that's why it has to be more kind of compulsory and coming from the RCSLT, because, if it's compulsory, then the universities are going to have to do it. They won't have to wait until someone that is, at the university thinks it's important. This needs to be compulsory now, and universities need to start thinking about it right away, I think.
Yeah, absolutely, I agree. And I think it should be, more commonplace for us to have service users. So we often you get somebody come into your university who's got a speech difficulty, or their child has, but more common that we ask BAME people to come in and talk about their experiences, positive and negative, of having speech and language therapy. How did their cultural impact on how they progressed and how they worked or didn't work? I think those kind of stories, hearing it from actual service users that come in and say, actually my child came in and this was removed and I felt a bit offended, or whatever, hearing it from, I think that would be a good place, is to try and engage more, not just somebody who's got someone's got this condition, so they've come in to talk to you, but someone's got this condition and they come from this angle of bringing their story. I think we could do with a bit more research in this. Often it's about demonstrating it makes a difference. If we can have some data that says the outcomes were better because culture was embedded in this person's speech and language therapy process, or these many people had SLT without any consideration of culture, these people did, and there's actually some tangible things. I think those kind of things matter as well. At the end of the day, evidence-based practice, we can talk all day long because we know it's important, but it would be good going forward that there's kind of some tangible things to hang on to, that this study actually found that it made a difference to these people's outcomes or how they engage. I think those two things are kind of more service user involvement, some more data. I don't know if it does exist. It might do.
Yeah. Okay, so I was reading this book, which is Dual Language Development and Disorders. So that's by Joanne Paradis, and it's got a whole chapter about the language culture connection. And it just has a bit at the end of that chapter about how really important it is to understand culture and embed culture into practice. So I'm just going to read a bit out now. So it says, time and attention need to be given to developing intervention strategies that do not contravene children's or their parents' cultural norms. Intervention with children with language impairment is the language-based activity. Because language is rooted in culture, it is also a culture-based activity. Culturally inappropriate requests in non-mainstream homes are not likely to be met, and moreover, they reveal an insensitivity that will erode the clinical relationship. They disrupt natural parent-children interactions, and over time, they risk contributing to cultural loss. So I think that just really goes to show, there is obviously evidence out there that shows that we really need to be thinking about culture when we work with clients. And if we make suggestions for intervention that is not culturally relevant to the client, then that they just might not actually do the intervention. They might not carry out that intervention. So unless we are embedding culture into clinical practice, into what we're asking the clients to do, then it might even be quite pointless what we're trying to do anyway, because if it's not culturally relevant to them, they might just not comply.
And we will put the reference for that book on our Twitter for anyone who's interested. So does anybody have any sort of final roundup comments that they want to share?
Yeah, I've got some thoughts. I think I do think that there are some things that as a profession it's okay to acknowledge that are our blind spots, and we don't necessarily have the expertise on. So I think it's one way forward is possibly to have a more multidisciplinary approach to how speech and language therapists are taught and trained. So, can we not have kind of a module that's kind of got input from sociology and some anthropology and some just some grounding in terms of a contextual understanding of the communities we seek to serve and the society that we are going to be working in. And I think that could possibly be one way forwards in acknowledging that at the moment the majority of our professors, lecturers do not have the skills to do this teaching. That's just the frank truth of it. They might have, they might be nice people and all the rest of it, but they don't have the skills to do it, which is why they're not doing it and it's not happening. And I think we've waited long enough for it to sort of be developed and it just hasn't happened. So something needs to change, clearly. I think the other thing would be from, I don't teach, I don't do anything within the university, but I think as a speech and language therapist within a service, I think I also have a role to play in terms of making sure that the student experience is a better one. And so I think we need to also be having these conversations within our places of work and within the services in which we operate, and acknowledging that our white colleagues are going to have some gaps in terms of their ability to be effective Ps sometimes, and knowing that we, within acknowledging our own position of power and authority within that workplace.
I think it's really important to engage with clinicians that are out there. There's still a lot of work to do, but there are a lot of BAME speech and language therapists now, and I think universities need to engage not just with people that are experts in conditions to come in and be guest speakers, but actually to get speech and language therapists that work with diverse client groups or are from BAME backgrounds to come in and talk to students about their experience, about their work, about their the cultural aspects of what they do. I don't see why it doesn't have to be all about kind of the academic element of bringing people in. I think it should be much more about the workforce and students getting to understand the workforce and how that can contribute to kind of their understanding of culture. So
yeah, I was just thinking about placements actually, talking about my experience on placement earlier on. I mean, I guess there's a bit of a problem when, your placement supervisor might tell you to do something that is not culturally appropriate. And I guess that comes down to, we need to be educated at universities so that we can, deal with these situations when they arise in placement. But then I guess you also need to be able to have someone at the university that you can talk to about things that you think may be culturally inappropriate that have happened on placement as well.
I think that's completely a really good point about placement. When we were at university, we had something called PPDG groups where we would break in and talk about our experiences on placement. And oftentimes that was our given space to talk about any issues there. But talking about experiences in terms of diversity, being the only person of color in the room is really uncomfortable. So even if I experienced it, I wasn't going to share it with my peers who definitely could not relate to what I've been through, and especially with people who I didn't know as well. So I always felt like even though university was giving us a space to do that, it should have been more of a facilitated conversation, because that's not a comfortable space to be in, and I don't want to be a token representative person of color. So it would have been more helpful if that been university taking more of a leadership role and being willing to lead that conversation rather than, hey, sit in a room and talk about your experience on placement.
We're just going to round it up on that note. We're going to be carrying on these conversations next week, and we're definitely going to pull out some of the really vital points that everybody today has made. So thank you again so much, Sharon, Mariam and Mehreen, for joining us today. We really appreciate it. Really appreciate your views. So today we spoke around the education of cultural competency, why it's important, why it's necessary, and how we think there needs to be a better approach to the teaching of cultural competency at university, and sort of the outcomes from that. Next week we'll continue the conversation and move it on to that in practice in the workplace. What does cultural competency look like when it's implemented right, and what are the barriers to being a culturally competent practitioner and a speech therapist. Be sure to follow our Twitter and our Instagram,
SLT Time,
At SLT Time.
SLT Time, to keep up to date with new episode releases.
And that's the SLT for today.